On behalf of the employer commissioners bargaining health benefits for public school employees, I want to take a few minutes to talk about VEHI premium rate increases that we've seen in the last few years and what is driving them. On the screen, you can see that the average increase for the last 4 years since VEHI introduced the new health plans has been just over 11%. Now, we know that a lot of this cost is driven by increase in prices, hospital budgets, the rising cost of specialty prescriptions, the increasing costs of MRIs, and so forth. But let's dig just a little bit deeper. If we break apart those increases, we can see that the normal cost increases averages about 5.5%, and about 5.4% is actually related to the HRA funding level. When the new health plans were introduced by VEHI, the premiums were significantly lower than they were in the VHP in 2017. The reason they were significantly lower is that the out-of-pocket costs were higher, so less premium dollars needed to be collected because VEHI would pay fewer claims as employees themselves would pay a greater share of their claims with the higher out-of-pocket costs. Of course, VEHI, which is jointly governed by the Vermont NEA and members representing the municipalities, school board members, superintendents, and business managers, for example, they understand that when the new health plans were introduced, employees would not pay the entire out-of-pocket costs themselves, that the employers would offer either HRAs or HSAs or some combination of those, and that the decisions about that would happen at the local collective bargaining level. So VEHI had to make some assumptions about the HRAs, and they decided that it was reasonable to think that the employer would cover a fair amount of the out-of-pocket cost, but still leave the employees with an increased out-of-pocket cost. This dynamic, the employees having more engagement and connection to the cost of the pharmacy and medical services they're using, would help to incentivize employees to use the resources VEHI developed to make some changes in how they used healthcare. The changes would be to reduce the low-value care, moving to generic medications, avoiding duplicative services, things that I've talked about in a separate video, and help reduce the overall claims paid by anyone, actually reduce costs to the system without harming healthcare. What happened, however, was that the HRAs were so generous at the local level and now in the decision that the arbitrator handed down in 2019, that basically the HRAs have made the plans richer than they were in 2017. And you can learn more about that in the video on actuarial value. And that the HRAs basically negated any of the gains that were expected to be made. They muted any incentive for individuals to think about costs in relationship to the healthcare services they use, and instead actually protected employees from the cost of healthcare even more than they had been exposed to in the VHP. In the VHP, employees had to pay a copay at the pharmacy every time they picked up a prescription drug. In the current HRA, the value of the HRA is greater than the maximum pharmacy exposure for the year. And so most school employees will never pay anything at the pharmacy to pick up any medication. This increase in premiums, the 5.4%, is estimated to be about $38.4 million of premiums collected that could have potentially been avoided had the HRAs not been so generous. One of the things you may want to look at if you want more information on this topic is the annual communications that VEHI puts out. These are available on the VEHI website at vehi.org in the rate section. back through 2017, you can find these announcements that explain the rate increase and the reasons for that rate increase. You can see in FY19 that it talked about the double-digit increases being driven by collective bargaining agreements that covered a greater share of out-of-pocket costs than anticipated. This meant that we did not see the reduction in claims expected. Therefore, future premiums had to increase in order to compensate.